Tanya, a quick preview of just the topic so you know what we're discussing. In
Yes.
short, I just discussed the restricted and repetitive behaviors and how that's a very common issue that we uh, have with the population that we work with, individuals on the autism spectrum disorder. I've I talked about one of the clients I have who's 20 years old. He's um, a big guy, and he is physically stronger than his parents. So if he wants to do certain behaviors like get rid of food or buy a lot of food, he is able to control what everyone in the family does just because he's the biggest family member. And I've been working with him for 7 years, but still I have not had success with reducing these behaviors for various factors that I also talked about. Um, but then that client led me on a journey to look at the research and what's out there. And that's when I came across habit reversal training and I thought it was very interesting and very promising. So I went into the research and I read what's out there. And that's kind of what I was giving you a summary on. I came across two studies, one from 2010 that uses habit reversal training successfully with reducing toe walking in 3 children with ASD. The other study I found on that same population was the one I was talking about when you joined, and it's not a very good study, so I don't really need to talk about it more. But then at the end, I gave the overview, which is that the habit reversal training actually gives a very effective package that we can use with individuals who are more verbal. I don't think this will be effective with my client, AB, who is 20 years old, because he's nonverbal and he doesn't have the motivation to reduce his stereotypical behaviors and restricted ritualistic behaviors. But I can see it being successful as an intervention with individuals who are verbal and socially aware and have that motivation to want to be accepted by their peers, for example, in a school setting, to reduce their verbal stereotypy or motor tics. And then, at the discussion, we can talk about what other procedures you guys have used to successfully reduce restricted and repetitive behaviors with your clients.
Thank you, Amna, for the recap.
Yeah, no worries.
Okay. Do you have clients who has repetitive behaviors?
Me?
Yeah. Or yeah.
Right now, I think all of them do, but mostly they're redirectable. I only have one client who I'm having trouble redirecting his stereotypic behaviors. And with that client, what I do is just response redirection. So we just use maintenance or high P trials, and then we usually get him out of it. So as we do high P trials, we get reinforcement, and then he snaps out of it pretty fast. But I don't think it's to the degree of Amna's clients. Yeah.
Yeah, I was saying to him that this client, he has a long learning history. He's 20 years old, so he's had his whole life where his behavior was reinforced. So it is very difficult. I also have another client who is 12 now, and he has global developmental delay. He has epilepsy. He has a lot of health issues, but he engages in high levels of motor stereotypy specifically. So lots of jumping, slapping his hands, and laughing, and it's his way of expressing excitement. He does it a lot when he's out in the community, out in public. And for his parents, especially his father, he does not like that. For him, it is embarrassing. He wants his son to stop doing that. It really bothers him. But for me, as like a clinician, that's his way of expressing his excitement, and it's not harming him. It's not harming others. So I always run into this issue of like, why would I like work hard and use time and resources on trying to reduce this behavior when it's not really impacting, like it's just him expressing he's excited to be out in a shopping mall, for example. It is a very difficult behavior, like motor stereotypy or like any kind of stereotypy. Reducing is hard, and some parents fixate on those things even though they're not the most important. What about you, Jean?
Yeah, in my case, in Korea, or I can't say in Korea, but for the parents that I've met, they also had similar issues like Anna's parents. They didn't want to see their kids engaging in stereotypic behaviors. But nowadays, I think they do understand that it can be a part of deficiency in the play, social play or play skills that they have, because some of the repetitive behaviors, they are engaging in it because they don't have things that are fun. So
Yeah.
some are done for their what sensory, some
Mm.
things are done for their sensory stimulation, and that's the only things they can find pleasing, pleasurable, because
Yeah.
they don't know how to play. So these days, it's actually what in ABA centers recommend. They try to build more skills in the play, and it parents now sometimes understand that it will help with the stereotypic behavior if they try to teach them more play skills. So it's like indirectly impacting the stereotypic behavior also.
Yeah.
So that's kind of the things that happens. And
Yeah. That's excellent. Yeah.
yeah, and some very open-minded parents who I work with, they use it like handly. They are perfectly fine with their kids engaging in stereotypic behavior. They understand, and then they let their kids do it in their free time or at home. They say it's their safe place where they can do anything they want. So if they had like social what do you say, if they weren't allowed to do it in the social environment, back at home they could do it as many times as they
Oh
want,
yeah.
as long as they want.
That's excellent. That's really good.
Mm-mm. So yeah.
And I like your point about teaching leisure skills as a prevention strategy, because it has to be done at an early age.
Mhm.
I've worked with a lot of older individuals, teenagers, um, who engage in a lot of stereotypic behaviors. And at that point, it's really, for most, it's really late. And when we try to introduce leisure skills and we try to teach them age appropriate, like alternative behaviors, anything they can engage in instead of stereotypy and socially inappropriate behaviors that are automatically reinforced, it becomes very challenging when they're older. So yeah,
Mm.
starting early and targeting play skills and early intervention, I believe should be one of the most important areas that we as professionals work towards, even if, at a young age, stereotypy is not a big issue. we should, based on what we are seeing with the teenagers, like from that population, we should be trying to preempt that and educating the parents on the importance of play skills. A lot of the younger children I work with, like their parents want to focus on, speech, like getting them to vocalize words if they're nonverbal. They want them to work on academic skills, tracing and writing. And it is up to us to educate the parents that, that, of course, communication is the number one thing that we work on first and foremost with most of our clients. But then the second thing should be, an early intervention should be play skills and leisure skills. It shouldn't be academic. It shouldn't be focusing on the things that would make the child look the most typical. But thinking about the bigger picture and the long-term goals and what this same child would be doing as a teenager and how they would be spending their time. Yeah, or else they would end up like my client who enjoys very ritualistic and repetitive behaviors.
Yeah.
Yeah.
Actually, for your client, I had some questions. It's not it's not about the practice itself, but
Yeah.
when you explained his routines,
Mhm.
so you told me that he could spend time spinning around the table for
Yeah.
up to an hour. So
Mhm.
so does that mean the routine can just depend from time to time? Like if the time can be different, the duration can be different. The
Yeah.
duration
Uh,
isn't a routine, part of the
I
routine.
don't actually like. I have not seen the behavior myself because these are
Oh.
virtual sessions with the father, right? So he would
Oh.
explain. He would describe to me the behaviors, but I have not seen them myself. It is just based on what he had told me. As
Mhm.
far as I understand, uh, they as a family they have a routine. They have their evening routine where they have dinner and so on. But the
Mhm.
timing varies. So
Oh.
the dinner might take an hour. The dinner might take 3 hours, depending
Mm.
on how long it takes AB to sit down and finish his dinner. And
Oh.
so they do have a routine, but it is a flexible routine. Like it will be based on however long it takes them to do each thing. Because then
Oh.
after dinner they would go for a ride in the car, and then they would come home and AB would take a shower and then go to bed. But all of that will vary depending on how much stereotypy he's engaging in.
Mhm. Oh, okay. Just was curious about.
Yeah.
Yeah.
Do you have any experience with Greg Hanley's using stereotypy as reinforcement strategy?
For me, actually, I don't. I'm not sure if it's like it was given as a reinforcement, but I would let my client engage in the stereotypic behavior during free time. So it's
Yeah.
not,
Okay.
it's not really like a reinforcement. Like
Mm.
it's not in the
Is it
ABC that I use.
contingent on
Yeah.
them completing table time?
Mm-mm-mm-mm.
Yeah, but it could be viewed as reinforcement, right? Because escape from table time can be considered as the reinforcement. But it is really interesting research. Maybe we can talk about this in one of the future meetings we have.
Yeah, I think Dr. Hanley is like quite getting famous in Korea also
Oh
these
yeah,
days. Yeah. Like
he's
he has.
very,
Mhm.
very well spoken and charismatic.
Oh yeah.
Yeah.
Yeah. Have you
Tanya,
guys?
have you? Oh, yeah.
Oh, sorry. No, I haven't. I'm not familiar with Henley's work surrounding stereotypy, but like components of it, like not demanding, requiring them to follow something and then getting access to the stereotypic behavior I have done, but specifically his package I have done before. I actually, when I was talking about my client, the one going around the table for an hour, reminded me of a previous client I had. So when I had this client, I wasn't the BCBA. I was like the therapist and like the educational, like the academic person. But we did something called the competing stimulus assessment. Have you guys heard of it?
No.
So
Sounds familiar.
yeah. So essentially, what we were doing is we were finding a competing stimulus or activity that can stop the stereotypic behavior. So Amna's client, he goes around the table for an hour. My client, for that one particular, one time he was scripting all day and then he was peeing in his room for the whole day because that was his stereotypic behavior. So when he was doing things like that, it was really hard for us to program anything because even when we were talking to him, it was like we cannot get into his brain. Like he wouldn't even eat, wouldn't do anything. He would just like defecate and pee everywhere. And he would just like rock back and forth, back and forth. So the BCBA in charge decided that they wanted to try a systematic way to find like the competing item. So I think it's related to the response redirection method, but instead of just doing like random activities, they were taking data and identifying which activities work best. So I think the dependent variables were duration. So they did like a whole interval recording of the engaging with the competing activity. So they took that data and they took data on problem behavior also. And so they just did that for a couple months, but it didn't work. So I don't know, but the method is from Kennedy Krieger Institute in the States. And I think it worked for other clients, but with this client in particular, it didn't work. So they ended up working together with like the doctors to prescribe medicine. So I don't know. Maybe Amna, with your clients, are there, aside from ABA, is there any other professionals?
Yeah, I did talk about that. Yeah, his dad took him to a psychiatrist, and she ruled out OSD, OCD, and she did prescribe medication. I think I don't have data on this, unfortunately, just because I'm not with the dad is not collecting data. I've not asked him to. That would be too much. But so I don't have data to show whether or not there has been a decrease since the doctor prescribed the medication. But the behaviors are still happening. That much I do know. Maybe they're happening with less intensity. Maybe they're happening with less frequency. I am not sure about that. But yes, he is on medication now.
With Tanya's case, I also have a question. So for sorry, I forgot.
It's okay.
Okay, we can hear you. Oh, okay.
Someone else can
Oh, okay.
discuss what. Yeah, I forgot what I wanted to ask.
No, that case you talked about, Tanya. That's very sad. We've had clients like that before, especially ones who engage in vocal stereotypy. And like exactly the way you described, they would be in their own world, and no amount of high P's can get them out of it. Like I've had a client where we were not able to get through to him, even with the high P's. He would just ignore us and keep scripting, and he would look, like gaze into the distance and just be very absent, like minded. He would not be with us, and like that's the most difficult, because you try to teach, for example, daily living skills. You try to teach, for example, brushing teeth or getting dressed or anything, but the child is not motivated to perform the skill, and they're not really with you. So no matter how much prompting you do, it's very disheartening and difficult with these types of clients.
Yeah.
Yeah.
Oh, I know what my question was.
Yeah.
So thank you, Amna. So for your client, so it wasn't maintained by Escape, so it was really automatic. So that behavior happened in all the situations, like even at home and stuff.
Yeah. So
Oh.
with this client, this is a client from the residential setting, GN.
Okay.
So, yeah. So this was he was living in a dorm with other peers, and there were days when I would come in, and even before the day started, so when he was still like sleeping, he was engaging in stereotypic behavior.
So while
Wow.
sleeping.
So like everyone was asleep, no demands, nothing. The lights were off. Instead of sleeping, he was engaging in stereotypic behavior.
How old was he?
He was 16.
Oh, okay. Oh, wow.
And then what made it hard too, when we tried interrupting, I think the reason why the CSA, the competing stimulus assessment, didn't work with this client was because when we did it with him, there were times when he would engage in severe problem behavior. So he would engage in depression.
Oh.
So that made it really hard.
Oh.
Yeah. Yeah. I think the last time I was there, last I heard of him, they ended up, it's very sad, they ended up like upping his medicine dosage. So he isn't as active like physically as before.
Oh.
It's very sad because I don't know. Yeah.
Oh, okay. And he didn't have any other problems with like bladder control or anything?
Bladder control. He was still in the process of like potty training because he still would have like accidents and things like that. But I think I'm not sure, but I think he used to play with his private part and like squeeze it. So I think it became like a sensory thing for him too.
Oh, wow. So when was the right time for you guys to do the assessment?
So we
Competing
had
stimulus assessment.
So we had a criteria of him like not engaging in problem behavior for a certain amount of time. I think at that time it was like 15 minutes consecutive. He was in a good spot. He was following instructions, and then we did the CSA. Oh no, sorry, wrong. The criteria was 10 consecutive minutes of him engaging in stereotypic behavior.
Oh, okay.
So when he engaged in the stereotypic behavior, he would come in, and then we would introduce different items. So for example, one of his stereotypic behaviors was playing with his private area. So we would find something similar. So it can be like coloring or like playing with blocks, things like that. And we just would give it to him using like verbal encouragement, like, okay, let's do it like this. Good job. Like that for 5 minutes, and we just take data and see how many % of that session he engaged. and then we would rank it, and then we would just use the number 1, 2, and 3 to block, to like redirect his specific
Okay,
behavior.
that sounds good. Okay.
Oh yeah, yeah. I think
Yeah.
it's much better than like using random things
Yeah.
and just doing the high P with the demands.
Yeah.
Yeah.
But it was a lot of work. I think because we were the ones running it, we had the client all day because it was a residential setting. So we had access to him 12 hours a day. So with him, it made sense to do like these more complicated assessments. But looking back, if say right now, like my clients, they're with me like 6 hours a week.
Mm-hmm.
Maybe if I try using like high P and it doesn't work, I'll do it. But I think it wouldn't be like a first because the work was a lot for what it is.
Mm-hmm.
But for me.
Oh, okay, okay. Mhm. Any more things that you want to discuss, Amna, or from
I think
Tanya?
that's good for today. Yeah.